Guys, breaking news out of Washington. We know that President Donald Trump and his wife have been diagnosed with COVID-19, but now reports are saying that he is headed to the hospital. That is right. He is headed to Walter Reed National Military Medical Center in Bethesda, Maryland. According to sources, his aides apparently are saying that this is a precautionary move, and that officials say they expect him to be there for a few days. Now, guys, there's a lot that we still don't know about his symptoms. We've been given reports. Some people say he's had mild symptoms. Some people say he's had moderate symptoms. Some have said he has a lot of fatigue, a fever, but we don't know how high and necessarily for how long he has had that. There's also been reports about some of the treatments that he is being given. Apparently, Regeneron, an experimental monoclonal antibody treatment, he is apparently being given amongst other things as well. The White House press secretary says that the president remains in good spirits and has mild symptoms, has been working throughout the day, but then says that out of an abundance of caution and at the recommendation of his physician and medical experts, he will be working from the presidential offices at Walter Reed for the next few days. You know, guys, there's a lot that we still don't know. There's many variables here. Of course, this is the president of the United States, and with him, just as with honestly anyone, we need to be cautious and we need to be very thoughtful, and he needs to be monitored very closely. Some questions I have as a physician is, how is he clinically doing? That means, how is he doing? How does he look? How does he sound? How does he seem? Is he breathing okay? How fatigued is he? How high is his temperature? Is it coming down with fever-reducing medications? Are there other symptoms that he has? Are there concerns that they have that they need him to be monitored in a higher level facility than, say, the White House, which I imagine that is probably the case because they are sending him to the hospital. And again, how precautionary is this in terms of where his symptoms are? The most important thing is that he is being monitored very closely because, as we know, symptoms can come 2 to 14 days after exposure to COVID-19. First of all, symptoms come a medium of probably about 5 or 6 days after someone's exposed. But we also know that symptoms sometimes don't get severe until later on, right? So sometimes people start out with milder symptoms and those symptoms get worse. We don't know if that's going to be the case with President Trump. We certainly hope that's not going to be the case, but we simply don't know. So again, there are a lot of questions about his clinical status right now, how he's feeling, how he's doing, but it sounds like they are taking precautions and being very cautious with him by having him and moving him to a hospital. In fact, they expect him to be there, according to sources, for a few days. Guys, we're going to keep following this story. This is a lot of stuff going on right now. It even underscores even more the importance of us all wearing our masks, social distancing, understanding and respecting this virus, because clearly it does not discriminate. Stay away from groups and from crowds. Take care of yourself and loved ones. Wash your hands. Use hand sanitizer. Guys, I'm Dr. Jen Caudle. Please subscribe to my channel if you have not already, and please share this video. We will keep the updates coming. I will see you soon.